This is followed by the next largest category of administration insurance at $91 billion more than we might expect. Here we found that in the United States, administration costs are nearly 5 times larger than the OECD average. This is due partly to the multi-payer payment system structure that creates higher marketing, underwriting, and administrative costs than many OECD peers. However, it is also on account of the complex nature of the multi-state regulated insurance system and other inefficiencies that exist, such as no standards for claim processing. It's a complex administrative system that costs us around $91 billion a year more than we'd expect. Those are what are greater. By contrast, the U.S. spending on long-term care and home care, as well as on durable medical equipment like eyeglasses, wheelchairs, and hearing aids, are actually less than we would expect given the country's wealth. So that's the basic math behind the United States' higher than expected health care costs. You get a lot more detail in the report, and you'll find copies of the executive summary and the materials on your table. Now, let me offer you a bit more math on how this all relates to private employers and to our national competitiveness. Of the $650 billion annual spending gap I mentioned, the amount we spend higher than what we'd expected given our level of wealth, private employers carry around $150 billion a year of that burden after accounting for the corporate savings from tax deductions for health benefits. $150 billion a year our employers are paying. Projected numbers are overwhelming. Assuming stable historical growth rates in employer-funded health insurance premiums, we estimate that employer spending on health care above the expected level for our comparative countries will exceed $1 trillion over the next 5 years, more than President-elect's proposed economic stimulus package is coming from the drain of excess health care costs. In these difficult economic times, the private sector should at least ask itself whether it wants to use its resources this way. When we ask why the United States spends so much other than we expected, our analysis points to several factors. First, and perhaps most importantly, there are misaligned incentives that favor participants at the expense of patients throughout the system. There is no one silver bullet. The system's misaligned. Second, as a result of that, the laws of supply and demand function very differently in healthcare than in other industries, with demand that grows in response to supply and is relatively price insensitive. Finally, there is a lack of value consciousness, and it's related obviously to what I just said, on the part of all those who are actually paying, whether that's providers, patients, and employers. When you combine that with the ongoing growth in costs, we find ourselves in a clearly unsustainable situation. Healthcare costs are growing at twice the rate of the economy, but with mixed results. So what should we look for in the discussion about reform? Well, without getting into details on all the proposals out there, there are a couple of broad principles that I think would be important, and those are underlying a lot of the conversation that we're trying to foster today. First, the involvement of all the major stakeholders, hospitals, payers, doctors, is critical. Employers have a vital role to play in terms of working with payers to address misaligned provider incentives and ensuring employees get the health care they need while consuming it in a value-conscious way. That's why today's events bring together healthcare stakeholders, employers, and policymakers who are so critical to jump-starting the healthcare reform process. Second, reforms need to protect innovation and leadership, which define our current system and much of the strength of the U.S. economy in general. And third, to generate any genuine political support, any healthcare reform proposal is going to have to take into account prevailing social values, particularly around individual choice and equality of access. In sum, piecemeal healthcare reforms won't make much of a difference. Reforms are going to need to address the higher costs across the healthcare system, particularly in outpatient care, and create the right incentives for those who consume, provide, and pay for health services. Indeed, without thinking about how to address the system more broadly, proposals that are just about extending healthcare access will drive an even more dramatic escalation of costs unless those issues are addressed simultaneously. While there are many different paths, reform efforts won't succeed unless they address both the supply and demand side of the system and create the right incentives for those who consume, provide, and pay for health services. One more parting thought. Within the current system structure, employers are actually the linchpin of making all of this happen. The level of attention and energy that business leaders give to healthcare reform in the next while here may well be the deciding factor on whether anything gets done. Given the scale and growth of the costs of the U.S. healthcare system, we can't afford to let that happen. Thank you.